course, whilst we talk about being ahead of many countries also, we've had Nigeria, we had this director of health also, Dr. Ezekwe also, raise concerns about, okay, not raise consent, but talk about the limitations.
He understands the limitations, but Nigeria will not go.
That's why they would not use what we're using. What does it say about the system that we're using? Because I raised that issue with Professor Ampofo. We'll get into our visit to Noguchi shortly. But what does it tell you? Because most of the things that you say you've introduced, other countries you say are following. But this particular system of contact tracing, Nigeria says it has its limitations. Reason why they would not want to venture into such an area.
I think if you check in the UK, they are now discussing contact tracing within the context of what we are doing here. One of the things that we've talked about in the weeks I've been here is that every country, and President Akufo-Addo was quite instructive when he spoke to other African leaders during the ECOWAS summit, that you have to contextualize your own measures within your country and ensure that the measures that you are taking are measures that you understand, backed by science, that will work within your jurisdiction. All of these measures, somebody can easily criticize and say, this your measure has this limitation, that your measure has this limitation. In fact, when we initially said, you know, persons coming from countries with significant community spread, which was 200, somebody said, why not 150? So you always find somebody, but that is why leadership is important. You make a judgment call. You listen to all the experts around the table, and you make a judgment call, and you hope that your leader in the chair who is making those judgment calls will get it right. Thankfully, we've been in a scenario where some of the things that we started doing early, those judgment calls that the president started making, which may have seemed unpopular, subject to critique, today we are beginning to realize that they are bearing good food for us, and other jurisdictions are beginning to also learn and pick from it. In Senegal also, they are going for a particular kind of testing using RDTs to do some antibody testing. Our experts here have been studying that model and explain to us what the limitations with their model is. Does it mean Senegal is wrong? Does it mean they are going to fail? These are judgment calls that leaders make. And we wish them well, just like how the Nigerians wish us well, we wish them well. But we are confident in what our experts and our leadership is also leading.